For someone who's looking to start with Nuviva, can you just run me through the step-by-step process for someone starting out with you to all the way to succeeding with their goals?
First off, before becoming a customer or a client of ours, we do offer free consultations to anybody who wants to come into our facilities. Really just get a chance to see if we're the right fit for them. This process may be short or maybe a long-term process. And obviously there's a lot of options out there that we may not very well be the right fit for them. So number one, it's a free, no obligation consultation to come in, sit down, speak with our staff, speak with the nutrition coach, understand what we have to offer and see if it fits what you're looking for. If you determine that we're the right fit and you're interested in moving forward, because we're a medical facility and we prescribe medications, we do set you up with an in-depth comprehensive blood panel, which is part of the sign-up fee, so you don't have to pay any additional funds for that. Majority of our offices do the blood draw right there in the clinic. Some of them will send you out to an outside lab. Again, it's still paid for by us, but we may just not be able to do the blood test right there at the time. We do EKGs, and EKG is kind of a check of the heart, make sure that there's no cardiovascular disease problems that you should be aware of and the doctor should be aware of prior to prescribing any medications to you. We're able to check vital signs like blood pressure, pulse rate, also do an initial weight on a person just to make sure that, of course, we know where you're starting and hopefully figure out, what your goal weight's going to be and how successful you'll be through the process. Check height. Height versus weight is what causes us to determine a BMI number, a BMI body mass index. So that kind of ratio, math equation, if you will, of height versus weight equals a BMI. And then we do body measurements. So body measurements also help us figure out, sometimes people don't lose a lot of actual pounds versus, pounds meaning weight, but lose a lot of inches. So it's a really good measuring gauge to see like how much they were able to change their physique. Now, as far as like the actual process, so going over our program, which is a multi-phase nutrition plan, our first phase is where you get started, and basically it's a dietary plan that's not medically sanctioned. So it's really a clean way of eating. We call it our detox diet. Basically, we're avoiding starchy carbohydrates, focusing more on like lean proteins, fruits and vegetables. We give some nutrition supplements to complement the diet at that time. And then basically you're kind of on your own, right? So we start by doing all the medical assessments, and then we give you a nutrition plan, and that's how you get started. The follow-up to that is when the blood work is final, meaning we get the results from the lab, and you've fulfilled about 1 week of dieting in the first detox diet, you'll come back in and see our medical provider. That consultation with the doctor is to review the blood test results, the doctor to obviously discuss with you your goals and make a decision if the medications we're offering are suited and are most correct for you. And if we figure out that you're healthy and everything we offer is good, you can progress through our program. At that point, you're now a client, right? So now you're a client who's capable of coming in on our weekly program and getting the medications that we offer. These medications can be distributed right out of our office, picked up, right there at the facility. So you're not having to go out to like Publix or CVS and wait in line or worry about something being shipped to your home. We make it right there, convenient for you. We're also going to give you your weekly injections of your B12 Bio Boost injection, which is a combination of some B vitamins and amino acids that help this process become more efficient. You feel a little better, have a little more energy, and enhance the fat loss properties, what's called a lipotropic effect by the injection itself. We can give you the different dietary supplements that will complement our program that we have formulated specifically for the program itself. And then we outline our nutrition plan that you're in. So these plans, we refer to them as phases. We have 5 phases at Nuviva. The purpose of each one of the phases is a little unique. The strategy behind each one is a little unique. The time frame of each one's a little unique. But ultimately, they're designed to keep a person fresh and educated and allowing them to lose weight through the process. So we go over that different phase with you at different times through the program. As you progress through the program and you're utilizing the medications and the supplements and the dietary programs we outline, at some point, you're going to hit your goal weight. Obviously, at this point, it's time to figure out what is life like without us. And rather than just kind of pushing you back out the door and saying, figure it out on your own, unfortunately, for most people's fate would be gain the weight back that they've lost. When we strategize with you is we utilize a piece of equipment called, well, it's not called, but it checks your resting metabolic rate. So your resting metabolic rate is how many calories your body can basically burn at a standstill all day long. So giving you a budget of calories that you, without burning any additional, would not lose any more, and without consuming more, wouldn't gain any more. And understanding what that number is, we can help you outline a nutrition plan to keep you at the weight you want to be. So the process of Nuviva starts with a free consult. We go through the medical kind of screening. You go through the weekly visit phase, eventually kind of finding yourself at the success you want to be. And then we give you kind of the program to succeed after the fact.